Hi, my name is Dan Weidman, and I'm a senior media communications major at Roger Williams University. I'm reporting today on the science of concussions, and how serious of an injury they could be to athletes. Joining me today is Josh King, head athletic trainer at Roger Williams, and Dr. Mark Andreozzi, who is fitness director at Roger Williams, as well as a former collegiate hockey player and current hockey coach. Now, Josh, what is the history of concussions related to how it impacts an athlete's body?
Well, basically, with the concussion, if your brain can't process proper signals, you can't train. So basically, it affects the athlete's body by almost shutting them down completely. It's almost like being inebriated, where you just can't function normally. You're in a situation where, light hurts you, sound hurts you, motion hurts you, so you take all of those out and you're basically just an inanimate object. You're just going to sit. But as far as the advancements, they're still advancing. I don't foresee it ever coming to an end. We have individuals that are dying early, that are having dementia, suicidal thoughts. The brain of a fully functioning NFL lineman at 40 looks like the brain of an 85-year-old person who is suffering from Alzheimer's. So, obviously everything's, we're progressing. Helmet technology, change in sports. Football is never going to be the same as it used to be. Men's lacrosse is not going to be the same as it used to be. It's still advancing.
How does it happen? How does a concussion occur?
Back in the early 90s and mid-90s, it was a transient alteration in brain function, which means basically when you get hit, regardless of where, on top of the head, side, mouth, whiplash effect, etc., the brain sloshes around. It sits in the cerebral, in the fluid that's in your head, and basically you bruise it. Now, depending upon how severe that bruise is, that's what dictates the severity of the concussion.
How have concussions impacted athletes at Roger Williams?
Well, basically what we look at is, number one is, if when an athlete sustains a concussion, they need to come in and talk to us immediately. We then go through our evaluation process. But I think the biggest thing is, because we're on a campus and you have dorms, you have people living off campus, I think once you sustain a concussion, you have to change your lifestyle. You need to tell your teachers exactly what's going on to keep them in the loop. In college today, in universities today, you guys are multitasking even though you don't think you are. And that puts a strain on the brain. You guys are texting while you're writing, while you're doing something else. In your dorm rooms, you have to account for your roommate, you have to account for your suite mates and everyone else, and put yourself into a bubble. And I think that's really, really key. And I think as we have progressed here, the academic side of things is what really takes a hit. And I don't think the athletes know how severe that can be.
So do you guys do anything before seasons to help prepare student athletes about concussions and help them learn more about it?
Yes, and it actually has come about due to the NCAA. We were saddled with the responsibility to educate the student athlete, and that's every single student athlete we have, every single varsity athlete, and we've actually gone as far as to possibly do this with our club sports in the future. But our varsity student athletes, they need to they sit through a talk. We basically use a scare tactic. We tell them all the negatives and what they need to do. Then they sign a consent form that they understand what's going on. They were given a sheet from the NCAA that we've copied millions and millions and millions of times, and they have that for themselves. They also watch a video by the NCAA, which is basically for those individuals who've seen it several times, it's kind of a joke now. But what we've done in the athletic training department is added to that video. We've added recent injuries that you may have seen on ESPN or around that people think are funny when they see it. It's just gut reaction, but when we go through the severity of it, it's kind of sobering. So we do that, and they also, again, our concussion rate has increased exponentially because of the education, not just because kids are getting hit more often.
So how do you think the athletes respond to these seminars?
I think that the immature athletes are going to respond exactly the way that we think they're going to respond. But I think with the coaches backing us, with the captains, with the student athletes that have been through it, with the athletes that have sustained concussions before, I think that immaturity changes rather quickly. It is. It's one of these things that when an athlete cannot process correctly, and they come in and they start to break down emotionally because they can't see the injury. It's not a scratch. It's not a break. It's not a sprain. It's something that's limiting them, exponentially. So I think that the athletes respond well, but it's our job to keep it fresh, to keep it new, to make sure that we don't, we scare them in a way and we educate them, but we want to have them, walking out of the room or out of a meeting with us, confident that we're here to help them. I think that's the bottom line, is, to make sure that they take enough time to rest. So
can you talk to us a little bit about the steps you guys take as athletic trainers to get these athletes back into action?
Yes. The actions that happen. So we have a student athlete that comes in, depending upon their symptoms at that point. We do what's called a SCAT-2, which is the Standardized Concussion Assessment Tool, second form, obviously the two. We go through that, which basically gives us a scale of 0 to 6 on all their symptoms. And then we go through their, their balance. We go through what happened with the injury. We go through their memory. We give them 5 words, tell them to repeat them back to us in the same exact order, which is tricky for them. We'll give them number sequences and have them repeat it back to us in reverse order. We do a balance, which is called the BEST, Balance Error Scoring System, which we use with them to stand on one foot or stand tandem and see, because obviously concussions affect your balance, like I've stated earlier. So we have them do that. We send them with a sheet that kind of gives them their symptoms, and if anything goes through the roof, as far as if it was a 1 or a 2 when I evaluated them, if it jumps to a 4 or 5 or 6, they need to seek to go to the ER. So at that point, we wait and see. We have them check in daily, maybe twice a day, just to see how they're doing. We contact their professors. We contact the dean of students, the coach. Obviously, the coaches would know already. We make sure that they are symptomatic, asymptomatic, which means they are symptom-free for 48 hours. After that 48-hour time span, they will impact test for the first time after their baseline, which was done in the fall or in the summer. If that is fine, then what they do is they start a 5-step protocol. We used to have our 5-step protocol with steps 1 through 3 used to be able to be done in a 4 or 5 hour time frame. But with the research and the education we have, it's now gone to 12 hours in between. So they will ride a bike for 20 minutes, come in, tell us how they feel. We always do a pre and a post evaluation when we do it. It's not a drawn out thing. You don't have a sheet of paper. You just check in with the person and then make sure you know what you found. The next thing after that is they do step 2, which is sprinting on a bike for 30 seconds, sitting for 30, and then they do that 10 times. They do a series of push-ups, sit-ups, and squats just to try and get, we're trying to get symptoms. If they pass that, then they go on to step 3, which is a little more, cardiovascular workout, a little more jumping around. Just again, we're trying to get symptoms. 4 is and they do a little bit of practice depending upon what they do. 4 is then more practice, non-contact. So they would be, if they were in basketball, they'd be shooting drills, running, things like that. We would put them into a scrimmage. And then 5 obviously is free to go. The problem that we've come across with these steps is that we've had to be creative with the sports that we have. You're not going to basically put a sailor through the same thing you would in basketball player, or you're not going to put a swimmer or diver through the same thing as you would put, a cross-country runner. You have to be. It's not set to 5 exact steps. There's some variables that happen with that. So at that point, then they are cleared. If there's ever a hiccup with that, if they have symptoms at any point, they revert back to that 48 hours and they go back in time and start all over again, which for a lot of student athletes, if they do hit that is really, really frustrating. They can't seem to process why. And we do not include a neurologist in this evaluation if it's that point. If they do have significant hiccups and they have problems with the impact test and their symptoms have not subsided, then we will seek external help, usually through our team physicians.
So Mark, how much knowledge was there about concussions when you played for the University of Rhode Island in the 1990s?
Not really a lot. There's probably very little, at least from what was disseminated to us as athletes. Especially in the game of hockey. You played. Back then I remember playing with headaches, or playing when people tell you get your bell rung, which obviously today is doesn't even exist. I remember playing in games that you get hit and you feel like you get your bell rung, and they're like, you ask you where you are, and you're like, you know it, but by the time the game's over, you don't remember playing the third period. So those kind of things weren't, the prevalence of them or the reporting of them wasn't around. So a lot of times when it happened in a game or to somebody on your team, it was just kind of, wasn't there. That information wasn't there. It really started to change probably towards when I started to get out of college in 1995, 96, around that era when a lot of major NHL stars started having these symptoms, and everybody's like, what's going on? And I think that's when things started to domino, and over the last 10 years it's changed.
So when you were a college athlete, was there anything done? Did the athletic training staff do anything to help you guys learn more about concussions and the seriousness of them?
Yes and no. Like I said, there wasn't a prevalence of this body of knowledge like you see today in 2012. There was, people knew of concussions, but it was more of, like I said, if you felt kind of headachy, dizzy, you were still okay to play. It was more concussions, more if you were knocked out. If you lost conscious, then it's a concussion and you didn't play. But other than that, you played. And, like I said, it was kind of when these bell rung episodes started to matriculate where major superstars in the NHL couldn't play, and then it kind of trickled down, to the lower levels of college, and where people were like, well, wait a minute, maybe there is something going on here. Not that they weren't concussions, but back then athletic trainers, coaches, and everything else were along the philosophy medically, even doctors were along the philosophy medically that, if you have coherency, you didn't lose consciousness, you're not having major issues of headaches, nausea, dizziness, then you were allowed to play. Where now, if that happens, you feel that nausea, dizziness, lightheadedness, you're out until you get cleared by an MD. So the perception of what a concussion is or grade of a concussion has changed.
So now that you have your master's in health and sports sciences and a doctorate in education, and you're somebody who understands an athlete's body, how serious are concussions, and how do they affect an athlete's performance?
My master's thesis was on concussions, because like I said, when I was in grad, that maybe because it happened to me and it started to become prevalent, and it was in hockey, I started to do research on the NHL, the American Hockey League, and at the time the International Hockey League, about how many head injuries that they had during the season, the course of their career, and what they did about, was it the helmets, was it mouthpieces, and looked at all that data, and the data really showed that, these guys would wear the same helmet for 20 years, and that obviously increases their rate of getting their bell rung of concussions. Concussions now are so prevalent in the media that we're on almost the opposite side of the spectrum, that anytime somebody has a headache, they have a concussion. From an athletic standpoint, you have a muscle pull. It's something that it's not, it's something an athlete can work through. When your brain is damaged, and because your brain basically sits in that water, cerebrospinal fluid, so it bumps around your skull. When it's your brain functions everything you do, your breathing, your speech, your sight, your hearing, your smell, your movements, all that. You can't put an ice pack on your brain. You can't put a heat pack on your brain. You can't do electrical stim on your brain. All those things that you could do for a muscle injury or a ligamentous injury or after surgery for an ACL that you could do to get an athlete back in tip-top shape, you can't do it to the brain. You only have one of them. And if when an athlete doesn't take care of those symptoms, or an athletic trainer or a coach doesn't deal with the symptoms and say, this kid's out until he gets better, you may for the short run of their career in college, 4 years, might not happen, but 10 years down the road, you may have problems when the guy's having trouble with his speech, he's walking funny, because the brain didn't heal the way it should have, and it constantly kept getting a blow to the head, almost like a Charlie horse, that repeated blow to the same side. Now we're affecting a kid 10 years down the road in his job and his life, and that's the part now where I think concussions have come to a good point, where that bell rung thing is a serious thing and it should be treated the right way, and how they need to. We're dealing with the symptoms and making sure an athlete is asymptomatic before they really start to progress back to playing again. And I think that in 10 years from now, because of what we know now, you're going to see a reduction in the amount of concussions reported or serious repercussions of a concussion. I think we're kind of taking care of it. Sometimes on the overboard part, but I don't know, sometimes it's better to be careful than not. So, like I said, I think now it's a serious thing, and obviously affected performance. You're slower in your reaction time, you're slower in your thought process, your motor skill reaction time is slower. Not only are you not performance-wise able to help your team, whatever sport it may be, basketball, football, hockey, baseball, but you in a contact sport such as football, lacrosse, contact sport like collision sport like hockey, you are leaving that athlete open to a more severe injury, not only from another blow to the head or a hit to the head where they're knocked out unconscious and may go into a coma, but to a knee injury, a shoulder injury, because they just can't react as quick as they should or used to. And that changes the whole scope of an athlete's play, and then in turn affects the whole team.
Well, thank you, Josh. Thank you, Mark, for providing us with that information. And please continue to follow this blog for more information about concussions coming in the next couple of weeks.